With the advance of tyrosine kinase inhibitors, TKIs, survival of patients with chronic myeloid leukemia, CML, has improved a lot. If patients die, many of these patients die due to other reasons. However, hematologists are mostly interested in those deaths they actually can prevent by applying a TKI to patients. We developed a score, the European Long-Term Survival Score, or ELTS score, in order to discriminate patient groups with different probabilities of dying due to CML. That is, our endpoint was death due to CML only. All other endpoints were treated as competing risks, were considered as unrelated to CML. The new ELTS score discriminates 3 risk groups with significantly different probabilities of dying due to CML, and it is also able to discriminate a low risk and a high risk group with different probabilities of overall survival. These qualities were confirmed in an independent validation sample with more than 1,000 patients. During an area where patients were still treated with chemotherapy, the Sokal score was developed. Our aim was now to compare the prognostic abilities of these 2 scores. First, we had a look at low-risk patients. The new ELTS score allocates 60% of patients to the low-risk group, whereas the Sokal score only allocates 40% to the low-risk group. Are these 60% really low-risk patients? We made an analysis. We compared the patients who were allocated to low-risk by both scores and compared their long-term outcome with the patients who were allocated to low-risk by the new ELTS score, but not by the Sokal score. And we realized that their long-term survival probabilities were not different from each other, so there is no reason to only define 40% of patients as low risk. The second aim we had was to investigate whether 20% patients are really high risk, as claimed by the old Sokal score. We analyzed this. We compared those patients who were at high risk according to both scores and compared their long-term outcome with the patients who were at high risk according to Sokal, but not to the ELTS score. And we found out that these patients who were not at high risk according to the new score actually had a better overall survival on the long term and had lower probabilities of dying due to CML. So there are not 20% high-risk patients as claimed by the Sokal score, but much less. And the new score is right to identify these patients as non-high-risk patients. So our conclusion is that it would be wise to apply the new score for prognostic discrimination now in the era of imatinib treatment, of other second-line tyrosine kinase inhibitors treatment, instead of the old Sokal score. And if you want to read more on this, ELTS score was just published online with leukemia, and at current the manuscript is in press.